Hi everyone, welcome back to my YouTube channel. Today we are going to talk about sternocleidomastoid muscle. We will start our topic with introduction, and here at the side you can see the diagrammatic representation of sternocleidomastoid muscle. Sternocleidomastoid muscle is one of the most prominent muscles of the neck. It plays a vital role in head movement, posture and respiration. This paired muscle is easily visible and palpable, making it an important landmark for anatomical and clinical assessment. Now let's talk about origin and insertion of sternocleidomastoid muscle. First we will talk about its origin. Sternocleidomastoid muscle has two heads, each arising from different locations. First is sternal head that originates from the manubrium of the sternum, contributing to the medial portion of the muscle. And the second is clavicular head that arises from the middle third of the clavicle, forming the lateral segment. Now let's talk about insertion of sternocleidomastoid muscle. In both the heads of the sternocleidomastoid muscle merge and insert onto the mastoid process of temporal bone and superior nuchal line of occipital bone, allowing the sternocleidomastoid muscle to facilitate head movements. Now let's talk about structural features of the sternocleidomastoid muscle. It is long, thick muscle positioned obliquely across the side of neck. Its fiber extend diagonally, allowing multi-directional head movements. It forms a distinct contour in the lateral neck region, making it visually identifiable. Now let's talk about function of sternocleidomastoid muscle. It performs various movements. Unilateral contraction: when one side contracts, it rotates the head to the opposite side and tilts it towards the same side. When there is bilateral contraction, when their both sternocleidomastoid muscle contract together, they flex the neck, bringing the chin forward towards the chest. The third is by it helps in respiratory assistance, as during forced inspiration the sternocleidomastoid muscle assists by elevating the sternum and clavicle. Now let's talk about innervation of sternocleidomastoid muscle. The sternocleidomastoid muscle is primarily innervated by spinal sensory nerve, that is cranial nerve number 11. Additional sensory innervations come from branches of cervical plexus, that is C2 or C3, aiding in proprioception. Next, we will talk about blood supply of sternocleidomastoid muscle. It receives muscular nourishment from multiple arteries, including occipital artery that supply the upper region, superior thyroid artery that ensure oxygen delivery to the lower part, and the branches from external carotid artery contribute to overall circulation. Further talking about clinical significance, it can cause there may be torticollis, that is rear neck, that is condition when sternocleidomastoid muscle contraction causes abnormal head tilting. It can be congenital or acquired due to muscle spasm or trauma. The second clinical significance is spasmodic torticollis, that is characterized by involuntary contraction of sternocleidomastoid muscle leading to painful twisting movements of neck. Second significance is sternocleidomastoid muscle syndrome, that is excessive strain of sternocleidomastoid muscle that can cause headaches, dizziness and neck pain of 10 due to postural imbalances or prolonged muscle tension. Now, further talking about clinical significance, there may be sternocleidomastoid syndrome, that is excessive strain on the sternocleidomastoid muscle that can cause headache, dizziness and neck pain, often due to postural imbalances or prolonged muscle tension. Then there is surgical and medical importance of sternocleidomastoid muscle, as understanding sternocleidomastoid muscle is crucial in medical procedures such as neck dissection surgeries, where careful dissection around the muscle is required. And second is physical therapy for muscle rehabilitation in that case of injury or chronic pain. And third is Botox treatment, where it is sometimes used to relieve muscle spasm and torticollis. Further talking about its functional importance, it has role in head and neck movements. Sternocleidomastoid muscle enables precise control of head positioning, ensuring smooth rotation, flexion and extension. Then it also contributes to respiration, as during forced breathing, sternocleidomastoid muscle assists in lifting the chest, aiding in deep inhalation. The third functional importance is landmark for medical examination, as due to its distinct position, the sternocleidomastoid muscle serves as a landmark for pulse assessment, nerve examination and vascular procedures in neck. And this was all about sternocleidomastoid muscle. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.